lagi bersama saya di channel Tekon TV. Stay safe, stay healthy, and stay connected with Tekon ID. Kali ini kita akan membahas sebuah metode pengobatan terbaru yang bernama stem cell. Tahukah kamu apa itu metode stem cell? Metode stem cell bisa digunakan untuk mengobati berbagai jenis penyakit yang mematikan termasuk kanker. Lalu seperti apa prosedur pengobatan menggunakan metode stem cell? Saksikan penjelasan Dr. Lim Zi Yi berikut ini. Tapi sebelumnya, tekan tombol subscribe dan nyalakan lonceng notifikasinya agar kamu mendapatkan pemberitahuan seputar video-video menarik dari channel ini. Dan jangan lupa follow juga akun sosial media kami di bawah ini ya. Dan selamat menyaksikan.
And answer later. But I just wanted to very quickly talk about this bone marrow stem cell transplant because it's an important way in which we can treat blood cancers. Yeah. So Dr. Ng has talked about importance of having proper diagnosis and finding the best way to treat our patients. And nowadays, the good thing is most patients with blood cancers, many of them, we just need chemotherapy or the new treatments to treat it successfully. Yeah. But there are some patients where the disease is more aggressive, where we may still need a bone marrow transplant for. Yeah. And this slide, I just want to show you first to show you that bone marrow transplant is an old technology now, actually, if you ask in the field. Yeah? Bone marrow transplants have been here for almost 60 years worldwide. And more than 1 million bone marrow transplants have been done around the world. So while it is in Southeast Asia, it's still not as many people are able to do it. Worldwide, it is actually quite an established procedure now. And many centers do. Like when I was in UK, we were doing 400 procedures a year in one center. So it's quite an established procedure for treating patients with leukemia. And what kind of diseases benefit from leukemia? A lot of blood cancers can benefit from leukemia, but not all patients, as I said, need to have the transplant, only the more aggressive types. Yeah. So when I write the list here of blood cancers like lymphomas, myeloma, sometimes they need a transplant, not all the time. Many acute leukemias, though, may need a transplant, and patients with a condition called MDS may need a transplant. But there are also some uncommon conditions like aplastic anemia, hemoglobinopathy, so things like thalassemia, autoimmune diseases. Sometimes we may all need to offer them a transplant, but this is all case by case. So usually, if we're not sure, we will need to make a detailed review before recommending. Yeah. And how do we do a bone marrow transplant? It is most cases where we use cells from a donor, we need to find a donor that is matched with the patient. Yeah, so we need to do special testing to make sure the donor has the right tissue to match with the patient. Then we collect the stem cells, and then the stem cells we will give to the patient after the patient has had some treatment for it. And I'll explain to it why. So the first question is, when we have a donor, how do we get the bone marrow stem cells from them? And there are two ways. The old-fashioned way is this one, which looks a bit bloody, yeah? But it is a process called a bone marrow harvest, where usually two doctors, sometimes myself and Dr. Ng, spend time taking blood out from the bone marrow to store. Nowadays, less than 10% of the time we use this process. 90% of the time we use this machine. This is called the apheresis machine. It's a bit like a dialysis machine, yeah? And what it does is that we put a patient or a donor onto this machine. The blood goes out from one hand into the machine. The machine will suck up the stem cells, and the rest of the blood goes in from the other arm. From the other arm. It usually takes around 8 hours on the machine, and we can get the stem cells we need for the transplant. So this is a much easier way of doing it now. And so 90% of patients, we use this machine to do the stem cell collection. And But to do it, we need a donor. So one of the big challenges we always is how can we find a proper donor for a transplant? So if you have a lot of brothers and sisters, that's the best thing. Because for every brother and sister you have, there's a 25% chance they are matched with you. So 25, 25, 25, 25 each time. So if you have 10 brothers and sisters, hopefully one of them will be a match. Yeah. But nowadays, families are getting smaller. Many people only have one brother, one sister. So sometimes we cannot find a match donor in the family, a full match donor. Then we have to look at the unrelated donor registries. So in Singapore, for example, we have a very big registry. In Germany and other places. Unfortunately, Indonesia doesn't have a donor registry at the moment. Yeah, there's a small one, which is, I think, trying to be started up in Semarang and some places, but it's very limited. So problem then is if we need to find an unrelated donor for Asian patients, sometimes the chances of finding it can be low, maybe up to 10 to 40% from there. So sometimes we have patients coming from Indonesia, needing a transplant. Dr. Ng's treated with chemotherapy, they're all ready for the transplant. But at that time, when it comes to transplant, we don't have a donor because they may not have a brother or sister who's a match. We cannot find a donor on the registry. So what do we do then? So that's one of the challenges we have. Yeah, and one of the things we are looking at nowadays. Because as I said, 25 to 30% chance you get a sibling or brother, sister who's a match. If you have no donor, if you're lucky, we find one on the international registry. If you don't have it, what do we do then if you don't have a donor? And we cannot find one match on the registry. So increasingly, one of the big things that we're doing at CFCH is we are using more and more this type of transplant called a haploidentical transplant. Haploidentical transplant is a special type of transplant using special techniques where the donor only needs to be a 50% match. It doesn't have to be a 100% match. In the past, you must be 100% or 90% match. Why is that important? If your donor only needs to be 50% match, you have a very, very high chance of getting a donor. Why? Because for every person, all your children will be 50% matched with you, guaranteed. Because you give 50% of your genetics to your children. So all of them will be genetic match. Same thing with your parents. If you're younger and your parents are not too old, so sometimes we have patients who are like 20, 30 years old, their parents are 40, 50 years old, then actually all your parents will also be 50% matched with you. Yeah, because you get half of your genetic material from your parents. Yeah, so automatically, if we can do haplotransplants techniques, it's far easier for us to find a donor, particularly sometimes for some people who have very small families and things from there. Yeah, so for example, when I first came, this is the first patient I did a haploidentical transplant on when I came back to Singapore in 2010, 2011. Yeah, this is an Indian patient because Indian patients are very hard to find donors, unfortunately, internationally. So this patient he actually works in the Singapore press, and he didn't have a donor. Yeah, very hard to find a donor. So in the end, this is his son. His son was his donor. Yeah, his son is a 50% match, and now he's still well. So I think it's a new type of technique that we are doing more and more now. So around 10 years ago, it was still early, but now it's become very established from there. So this is a new way to do transplants. So how do we do transplants? So transplants is a complicated procedure. Yeah. In most transplants, patients have to be in hospital for 3 to 4 weeks. And there are 3 parts to it. The first part is the red part, which is called conditioning. Red part is where we basically give the patient chemotherapy. And this is to empty out the bone marrow. Yeah. So that we clear the bone marrow, we make space for the donor cells to go in. The middle part is the yellow part. This is where we take the stem cells from the donor and we inject it into the patient. We don't inject it into the bone marrow, we inject it into the veins. Yeah, so it's a bit like donating a blood. It just goes into the veins and the stem cells find the way into the bone marrow to grow. And the last part, the green part, is the regeneration.
And it's an open door, and off my line of sight once more. Out of luck, out of luck, it'll all be fine this time. Out of luck, 'cause you always seem so kind. Out of luck, it'll all be fine this time. Out of luck, out of luck.
So when the stem cells go into the bone marrow, they will start growing. And usually it takes around 2 weeks for the cells to start growing from there. Yeah. So the whole process takes around 3 to 4 weeks of being in a transplant unit. We have special rooms in the 2 hospitals we work to protect the patients. The risk is that during this period, usually the patient has a very low immune system. So they are very at risk of catching infection. So we have to be very careful. Both the rooms have to be carefully prepared. The doctors and nurses have to be very specially trained to look after the donors so that they don't catch infections during this period. But this is data internationally to show you, we're doing more and more transplants nowadays. Even in the last few years, for us, we are increasing our donor transplants a lot in Singaporeans and non-Singaporeans. Why? Because as time goes on, we're able to do more and more transplants with older patients. So when I first started practicing hematology, anyone above 50, we were very scared of doing a transplant because the complications, the toxicities were very high. Nowadays, 50 to 60 is quite common. We will do many patients in age 50 to 60. As long as they're physically well, as long as we think there's a good chance of curing the disease, we will look at it. Even up to 70 years old, in good patients, we will even consider it nowadays. So the age of the patients is improving. We can do more patients for transplant. And the survival is also better. So this is, again, a chart showing the global survival. Nowadays, whether you are old or young, whether you have a sibling or unrelated donor, your 1-year survival is more than 60%. Yeah, and a lot of these are for leukemia patients. These are leukemia patients, the type which me and Dr. Ng treat, because acute leukemia is still one of the main reasons why we do a bone marrow transplant. Yeah. So finally, and Dr. Ng will talk a bit more, we have 2 centers in Mount Novena and Gleneagles, which are specifically designed so that we can provide a high level of care and in a very safe and clean environment for our patients. But Dr. Ng will talk more about it. And one last part as well is important thing when we talk about transplants. Transplants nowadays are, to be honest with you, if we have the right patient, the right donor, and the right setup, nowadays, many transplants we can do safely. One of the key things with doing a transplant, like anything else, is that we need to be aware and be able to manage if complications happen. Yeah. So there are 3 main complications of a transplant. 1 is if the cells get rejected. 2, if there are things like infections. And 3, if there's this thing called graft versus host disease, where the donor cells and the patient start fighting, yeah, and causing rejection, causing problems from there. So doing a transplant is okay, but you must have a team that knows how to manage the complications. So again, one of the things, and this is just sharing, in Singapore and certainly some other places, we have now developed many new techniques, both in terms of drugs, in terms of finding cells to deal with complications from transplants if they happen. So again, this is another patient I treated before who had very bad graft versus host disease of the gut, and we were able to find ways using special cells to treat her. So there are other ways in which we can manage the complications. So on one hand, we can do the transplants better and better as we go along. 2, we are better at managing the complications of the transplant.
Terima kasih telah menonton video ini. Jangan lupa subscribe channel Tekon TV. Share video ini jika kamu mendapatkan manfaat darinya. Terima kasih.